of long COVID kids and member of the NHS long COVID task force, and Rae Duncan, cardiologist and long COVID clinician and researcher. Rae, I'll start off with you. A lot of people will be wondering about long COVID. It's back in the news, and there are quite a number of people, including Sammie, who would prefer that it was in the news more regularly. But here we have the case of Derek Draper, and people will be wondering what it was about his condition that made it so debilitating and that in the end made it unsurvivable.
So the first thing I would say, and thank you very much for having me on, is I would just like to pass on my condolences to Kate Garraway's and her family. It's an awful loss. I can't comment on Derek's particular condition because I wasn't involved in his care. But if talking about long COVID in general, it is a disease spectrum, and it can be incredibly debilitating. I run a long COVID cardiovascular clinic. I see patients that are young, previously fit and healthy, who are now completely bedridden, unable to function, unable to walk. Some of them are unable to sit up for more than 20 minutes at a time. So it can be completely debilitating for many people with this condition, although it does vary on a case-to-case basis.
And what is it about the kind of COVID people who are so stricken like this contract versus the COVID that we have now learned to live with, and that people say, well, look, it's a flu for most people these days. It's an unpleasant disease, but most people will recover from it. Because time and again, we're hearing about long COVID, and we don't seem to be taking it that seriously.
Well, I'm just going to pick you up on something you said there, that the word in the street suggests that a lot of people think it is like a flu. Yeah. There was actually published data just last week from a group called Zaid Al-Ali's group in America, showing that COVID definitely isn't a flu, even though the index infection appears to be milder now post-vaccination and with the Omicron variant for many individuals. There's still a significant burden of chronic disease happening, and this paper compared flu and COVID directly and showed that over 10 bodily organ systems, 9 of those, they had significantly worse health outcomes if you'd been infected with COVID rather than flu, and the mortality rate with COVID was still higher. So one of the
Can you be more specific about those particular vulnerabilities?
Yeah, so certainly COVID is a multi-organ system. So what we know now, we know a lot more than we did at the beginning. It's a virally triggered, obviously by the SARS-2 virus, immune-mediated disorder that involves multi-organ systems right across the body, and we have seen evidence of vascular damage, so we know it's damage in the inner lining of blood vessels, neurological damage, it can cause neuroinflammation, damage to the autonomic nervous system, increased risks of blood clotting disorders, mitochondrial dysfunction. So there is, as we've learned more about it, there's definitely a lot of pathophysiological disease pathways being triggered by this virus, sometimes worse in some people than in others. But what I do need to point out here is that this is not binary. It's not that some people just have a mild index infection and fully recover, and there's only a very small proportion that have long-term problems. If we actually look at what the emerging data is showing, and certainly there's a lot of really good work coming out of the National Phenome Centre in Australia at the moment, there appears to be evidence that COVID may be altering our metabolic profiles and may be increasing cardiovascular disease risk markers, even in people that don't have symptoms.
That sounds really serious.
And we also have emerging data showing that the more times you get infected with and reinfected with SARS-CoV-2, the increased risk you have of going on to develop long COVID, but not just long COVID, other chronic diseases as well. So there's an increased risk of cardiovascular disease, increased risk of neurological diseases, particularly neurodegenerative diseases, we're beginning to see. Now, this doesn't prove causation, but there's definitely an association here.
Right.
And if we,
Let's finish there on the clinical side, Rae Duncan. Thank you very much indeed for joining us. Let's talk to Sammie McFarland. I'm just wondering how you're responding to all of this and to what we've just heard.
Hi, thanks for having me. So the entire long COVID kids team were devastated to hear today's sad news and send our condolences to Kate and her family. It's hit the long COVID community hard. Derek's story has been across the media and touch the lives of all of us directly or indirectly, either affected by long COVID or as parents or caregivers and patients. And Kate's bravery and advocacy has really provided such incredible insight into becoming a caregiver for a loved one with a chronic illness. And she's opened conversations on topics that just have been ignored for so long. I can really only imagine the strength required and the vulnerability she's felt while she's done that, while fighting and caring for her husband and children.
But what do the long COVID community want to see change? I mean, here we have a lot of attention being paid to the issues arising out of long COVID. That window will close soon, as you know. This is the way the news sadly works. What do you want people to think about? How do you want people to respond?
Prevention. This is something that's been ignored. It's something we've heard throughout the COVID inquiry that's been that was happening last year, and the next module will start very shortly. We've got 1 in 14 people estimated have COVID right now. The wave is sweeping our country, and experts have predicted that there are going to be tens of thousands, possibly even 100,000 or 200,000 people who will now develop long COVID from this. So we really need to see governments and policy makers investing, committing into prevention. We haven't had a single campaign warning the public about the risk of long-term effects of COVID and long COVID. We haven't seen anything about taking sensible precautions or mitigations. We need really big awareness on the importance of clean air and air filtration in our indoor spaces. We need reminders about mask wearing, and we just need honesty that we haven't seen. And we heard that all the way through the COVID inquiry, that the government had this information very early on and they chose not to share it. For fear of causing fear in people. And actually what we've done is we haven't given people the right information so they can make informed decisions and take care of themselves and their loved ones. And we all have a responsibility. This isn't about just anybody being vulnerable. We are all vulnerable. Everybody is at a risk. And what we've been through, myself, my daughter, 4 years of long COVID, we've not been able to work or attend education, and all of the members in our support group, we've got over 7,000 families who are living through this, and not one of them would want another family to go through this. It's a preventable disease, and we have a duty of care to make sure we are preventing more people from getting this preventable disease, which is going to overwhelm our health services, and it already is.
It is indeed. Sammie McFarland, founder of Long COVID Kids and member of the NHS Long COVID Task Force, and Rae Duncan, cardiologist and long COVID clinician and researcher. Thank you very much indeed for joining us on Times Radio. Your thoughts, please do text in 87222. Start your message with the word Times. I'm Henry Bonsu. It's a Friday evening, the 5th of January. Something completely different now.